All right, good morning, everybody. Thank you for joining us today for a webinar that we are delivering to community partners that are about to experience Wave 2 of integrated eligibility conversion. This is for all community partners across the state. We think this information will be very helpful, and it's just the beginning of a conversation because we'd like to offer more learning opportunities for integrated eligibility to make sure you as community partners have what you need to help your clients. So thank you for being here. Thank you for all of the work that you do. We have a big team of people here to support us in this and to support you in this. Today, we're going to talk about integrated eligibility and what Wave 2 is. We're going to talk about medical versus other one program applications, because that's a lot of what Wave 2 is about, is integrating the other program applications into the main application. Some options for use and best practices. We're going to talk about something called conversion and what conversion is, what you need to know and what to do about it when you encounter it. And we're also going to encourage you to join us for future learning opportunities, my favorite word, opportunities. But we will be continuing to offer these webinars to help you understand and navigate this integrated eligibility applicant portal system. And today, the team that we have with us are folks from Integrated Eligibility External Communications, pardon me. We also have people from the processing teams. We have people from OHA policy. We have somebody from eligibility transformation. That is the people part of the IE. So integrated eligibility is the technical and systems part, and eligibility transformation is how it plays out and the people part, the systems. We also have the One Business Analyst team, and we have OHA Community Partner Outreach Program, your regional outreach coordinators. Jessica Diaz and Deanna Simon are here today guiding you through this presentation, but many of your rocks are on the line as well. So thank you everybody for being here and pulling this together to offer to our community partners. So right now what I would like to do is I'd like to introduce Jason Simpson. Jason is with our IE External Communications group, and he is going to share some of the marketing materials, but then he's really going to talk about what they mean for you as community partners and what IE means for your clients that you're helping. So Jason, thank you for being here.
Thank you for having us, Deanna. My name is Jason Simpson. I'm one of the external communications reps on the project. My background is in SSP, and I'm joined today by Sarah Campos, who is also one of the communications officers on this project, supporting this work. So as Deanna mentioned, some of this information I'm going to be sharing has been more of like a marketing type of presentation that we give to our general external stakeholders, and also we share this information with legislators. Some of you may know something about one, some of you may not know a whole lot about one, so I'm going to give some basic information also. When I talk to people about this upgrade, one of the questions we always get is why one, and like, why are you doing this? And the reason is very simple. We wanted to improve the way Oregonians access our services. Imagine you are a single mom who just lost her job. You know you need health coverage, food benefits, and cash assistance. Prior to one, that might have meant 3 different applications, possibly visiting multiple offices, and then having to spend a lot of time on the phone while juggling everything else. The good news is that one changes that. One will give Oregonians more options to apply for benefits, renew coverage, update case information, and comply with program rules. Oregonians can create their own online account in the applicant portal, making future case updates even faster. Of course, if someone wants to call us, the One Customer Service Center is open from 7 a.m. to 6 p.m. Pacific time. And this is especially important for folks who live in areas without a local office or who have limited access to the internet. Oregonians can track the status of their benefits from a personal computer or their mobile device, but I'd want to point out we don't have a one app, so they'll need to do this on the browser on the cell phone. We're also able to upload documents online instead of making time-consuming trips to local offices. And for those people who would rather see us in person, they can still come into a local APD, type B AAA or SSP office where a staff member can help them. We're just asking that if anybody does come to the office, they call ahead because of COVID-19. So on the next slide, I'm going to talk a little bit more about what this means for our local offices and Oregonians. So what does this mean? All offices can help with all programs. Type B, area agency on aging, aging and people with disabilities, and SSP offices can do all of these programs. If one office is backed up, sharing work is easier and can be handled by a central workflow control. All offices can see the same information now, not like before where it was like, oh, you'll have to call APD or you'll have to call OHP if you want to see that information. And the shared workload will help us in the event of snow closures or, God forbid, another wildfire situation, but we'll be able to move work across offices a lot easier. All of our staff will be cross-trained in all programs, which helps processing times. The one customer service center can take applications for all of these programs over the phone. No more telling people that they have to go in person and drop something off. We can take the whole application over the phone, and we can also record the signature. I know some of this functionality was available prior for medical, but this is new for some of the other programs. Again, the online application will access medical, cash, childcare, and food. And then one set of information will clear all pendings and requests for information for all programs. Again, if a customer chooses to visit an office, they can now only have to go to one instead of visiting multiple offices. So if we take the example of the single mom who I mentioned earlier, she might have had to go to 3 different places and 2 different places and maybe do several different applications, but now that's just one single online application that makes it possible for her to apply for multiple programs. Next slide, please. I'll talk about rollout. So many of you have seen this before. We came and talked about this late last year also. So we've been rolling this project out in phases. We first started, I think, in December 2015 when we got some of the approval to greenlight this project. And as we roll out a new phase, we learn more information which helps the next phase. We started with the one upgrade and the one customer service center pilot on July 6th. This mostly had to do with us upgrading our former one system and adding in the functionality for former medical processing center staff to be able to process all programs. And then we launched our storefront office pilot in Grants Pass on August 3rd. And this was one SSP office and one APD office. Staff in those offices began to process all benefits for resident in their zip code. On September 21st, we chose select offices in District 6 and 8 for customers to be able to apply for all benefits online. This was another important step in the phase rollout. We also added the applicant portal functionality as well. On November 2nd, we launched our biggest phase yet, covering SSP, APD, and Type B AAA offices in 21 counties. That's the green area that you see there on the slide. And as you know, Wave 2 will happen on Monday morning at 7 a.m., and that's the blue part, in 13 counties in the top part of the state. So I'm going to give this over to Sarah now, who's going to talk a little bit more about the programs Oregonians can access through one. Thanks.
Thank you, Jason. So this table here shows all of the different programs that Oregonians can apply, have their financial eligibility determined for using one. So SNAP, which is we call food benefits, TANF, or what we call cash benefits, ERDC is employment-related daycare, or what we call childcare, and then medical assistance, or shorthand we use as medical, and then there's 3 other programs that are also included. So the top row there lists the main like kind of tentpole programs that are covered in one, and then some of the sub programs below those. I think what's going to be of most interest for this group is that medical now means MAGI, or modified adjusted gross income, as well as non-modified adjusted gross income medical. So that's you know, what the biggest benefit to Oregonians is that multi-generational families, maybe if a grandparent is living with their kids and grandkids, that whole family can have their medical eligibility determined using one application.
Sarah, can I interject for a moment just to clarify something?
Oh.
So I think everybody, you know, as we know, medical has been part of your applicant portal since July 6th. So you've been doing that. But if you're in these Wave 2 counties, the green counties, the top swath of the state, when people go to one.oregon.gov to apply, they cannot currently apply for these other programs, but starting February 1st, they will be. And there's a whole process to bring those cases into one that we're about to talk about, where all of these programs will now be integrated into the same system for the green counties, and that hasn't happened before. So that's how this all ties in. So some of this you've been doing, and some of it's going to expand. And you will continue to only apply for medical. I think that's the other piece we want to make sure everybody knows. is that what you help people apply for won't change. Back to you guys.
Thanks, Deanna, for that clarification. So as community partners, like Deanna said, that the medical application process will remain the same, and you'll log in on Monday if you're going to be in one of these converted counties at the top part of the state, just as you do today. Other parts of the state have already been using this functionality beginning on July 6th. One benefit is that as a community partner, you'll be able to see notices in the applicant portal for all programs, so SNAP or cash, food, and childcare, as well as medical notices. And we'll have a little bit more on this topic coming up on a future slide. But when benefits from the legacy system get transferred into the one system, we call that conversion. So we're going to do, well, okay. We know this is a big change for you, for Oregonians and for our staff. So please be patient with ODHS and our staff as we learn how to navigate these new programs, this new system, and a new phone system. We do expect there to be longer than expected delays for a short period until our staff gain momentum and get more comfortable in the system. We are kind of, merging eligibility workers from SSP, Type B AAAs, and APD, and some of them will be processing new programs that they haven't processed before. They've been thoroughly trained, but it is a little scary for them at first, their first couple days, as they learn this new work. So again, please be patient with us. We do expect that some wait times at the call center will go up on Monday, but they will come back down as staff get more comfortable. Next slide, please, Jessica. So this weekend is what we call cutover weekend, where we are going to convert those blue counties at the top of the state from old legacy systems to using the one system. One important thing to be aware of is that the cutover weekend is happening beginning on this Friday at 5 p.m. So that's when we're going to roll our legacy systems over into one. So the applicant portal and the one system will be down for the entire weekend. This date is the final phase in the transition to one. So customers who currently interact with ODHS using the applicant portal will be able to use the same login that they do today, and will only see that there's been a change once they log in to recertify or apply for benefits or for another reason to maintain their account. So these times are not exact, but we won't take the system down before 5 p.m. It might be up a little bit longer, but it's safest to bet that, plan to have all of your work in the applicant portal and the one system done by 5 p.m. on Friday. And then we'll bring it up online again by 7 a.m. on Monday morning. The One Customer Service Center, sometimes we call this the VEC or the Virtual Eligibility Center, will also be unavailable starting at 5 p.m. on Friday. They're typically open until 6, but they are going to be closing an hour early to accommodate the fact that the system will be taken offline at 5. And with that, I will turn it back over to Jessica and Deanna.
Thank you. So we're going to say it again just to make sure. Sorry if we sound repetitive, but we want to talk about how community partners continue to help Oregonians and integrated eligibility and what looks different. So community partners will still only assist with medical applications, even though when a client goes to the public-facing applicant portal, they will be able to apply for all of the programs. Now, if an Oregonian wants to apply for just the medical, the MAGI or the non-MAGI medical benefits, that core process that you as community partners are going through does not change. You still have access to the one applicant portal. You can help them apply through a paper or PDF application or through the phone, and you can still, you'll always use the email boxes to help resolve case issues. Sisters can also continue to help report changes, renew and review notices for medical programs, and do all of that as you have always done. Something you will see is that the notices that are sent from the system will all show up in the message center, your message center and your client's message center. And because the system is all integrated with the other programs starting on Monday, you'll start to see notices from those other programs. So when they get a SNAP eligibility notice, for example, or a cash assistance eligibility notice or other action, those will pop up in your message center and in their message box. You don't need to take action on those, but you can certainly access them for your clients, help them see those messages, print them out for them, send them a copy, whatever they need. But those aren't necessarily actions for you, but because all the programs are integrated, all of the messages show up. Now, if an Oregonian wants to apply for non-medical benefits only, that is not something they would do through a community partner. They can go to their local ODHS field office. And this is a big change too, is that all of the field offices, Jason said this earlier, self-sufficiency, AAA, and APD, will all be able to accommodate applications for all of the programs. So you don't have to figure out where to send somebody. That's part of how it's been made easier for clients. You can also go to a website, and there is a website that has been in existence, but it is going to launch in a whole new way on Monday. benefits.oregon.gov. I would like everybody to really earmark that in your computer, on your home screen or whatever. Benefits.oregon.gov is where clients will be able to learn about the different programs that they can apply for, and then get a link to that application at the applicant portal. But this is where we'd like to send everybody for information about all of the programs going forward. So please highlight that. Go visit it on Monday. It's going to look incredibly different than it does right now. It's more of a placeholder right now, and it will be very much more comprehensive. And of course, they can call the One Customer Service Center. And clients from any county across Oregon, starting on Monday, will be able to call the One Customer Service Center and apply for any of the programs. So any of the places where people can apply here listed on this page will work for any of the benefits. Now, if they want to apply for medical and non-medical benefits, there are a few options. I think as community partners well know, there are many benefits to working with a community partner. You can help people get through an application, you can help them with other services, you can help them navigate those medical benefits and get them onto coverage and figure out how to use them. So there are lots of advantages for community partners to help clients and for clients to come to community partners. However, when they want to apply for the other benefits, it will be more of a two-step process if they're working with a community partner. So there are a few options. They can simply just work with ODHS offices to apply for all the programs via a local office or the One Customer Service Center. That's always an option for them if they don't get all the other benefits of working with a community partner. They can also create an account, their own account in the One system, and apply for all the programs, and then attach you as a community partner to continue in the future to help them with medical benefits. That's fine too. They can also apply for medical with you as a certified community partner, and all of that, starting Monday, all of that information that they put into the application through you for medical benefits will transfer over, and anybody at a local branch can then pick up that information and continue that application for them. And they won't have to ask all of the same questions. They'll just have to ask the supplemental questions. Let's see, where are we here? So here, let's see, sorry, I'm trying to grab here. This slide really talks about one of the complications. If someone's in the process of applying for multiple programs, they've started an application on their own, and then they come to a community partner. Things can get a little bit sticky, so we really want to call it out. If an applicant has already submitted an application for any of the programs in One on their own, the public-facing applicant portal, and they started an application, and they're not already associated to a different community partner, you actually have the ability now to grab that case and have it associated to you as a community partner and have it show up in your applicant portal. So this is a really great benefit that our teams have implemented in the applicant portal. So what you would do is you just start a medical application for an individual, for that person. You start entering their information. And at some point after you enter the social security number, et cetera, it will start to look for that individual to see if they already have a case. And if they already have a case started, an application started in the system, and they're not already associated to some other community partner, because we can't undo existing associations, but if they're unassociated, then their information should populate in your applicant portal. They'll automatically become associated to you, and you'll be able to help them moving forward. So that's very different than what we've had in the past. This actually was implemented maybe about a month ago or so, maybe 2 months ago. You don't always have to call in to get a client associated to you. As long as they don't have a community partner association, they will pop up in your applicant portal. So that's great news. You can finish their application and submit it. But here's the big warning piece that we want to make sure you know. And this isn't a huge problem, but you need to know. So if an Oregonian started applying for multiple programs on their own, a good example would be they started applying for SNAP, Oregon Trail benefits, and medical. And they don't submit that application, right? They're in process, it's unsubmitted, and they say, you know what, I need help. So then they go to a community partner and say, I need help with medical. And the community partner goes through the steps above. They start an application, they begin entering information, it finds the person, it populates in their AP. At that point, it is only a medical application, and any information that they entered regarding SNAP or childcare or cash assistance benefits will be wiped, and they'll have to re-enter that going forward. So they can still work with you for medical, but it sort of starts the process over again. So we just want to make sure that you know that. It doesn't mean you shouldn't do this. Just be aware that they may have to repeat some information going forward. So this is where we get into some of that conversion stuff that we were talking about what happens when these two systems merge, because in many cases that will go smoothly, and in some cases there are some little snags. And so Jessica is now going to talk to you about what happens when the two systems merge on Monday, what you might see, and some of the situations you may run into.
Thank you so much, Deanna. Yes, so we're going to define and talk about these two terms that you see on this slide here, conversion and benefit mismatch. So we'll start with conversion. Conversion is the process by which ODHS transfers and merges any client case data that lives in those old legacy systems into the new integrated one system. And an example would be if someone was receiving Magi Medicaid and also receiving SNAP before these systems got merged, they were two completely different cases in different systems, and now they can become one case instead of having those separate entities that have to be managed separately. So for most folks, cases will convert without any issues. They will become active approved, and there would be nothing that you as a community partner and nothing that any member of the public would see that would make them think anything had even happened to the case. However, there are times where through the process of conversion, things don't go smoothly, and then further action needs to be taken. And so that will happen when there is something like the two different cases have different income information. There are discrepancies between the information we have on one case and information we have for the exact same household on another case. So when that happens, instead of converting, it gets stuck in this conversion mode until those discrepancies can be resolved. And so sometimes it's because there's differences between cases, and also there are some situations where there might be missing information on the new case that was not required in the legacy system, but is now required by the new integrated one system. So those are the two issues that we're talking a little bit about today. Eligibility workers cannot make any other changes or updates to a case if it is in conversion mode, so they must resolve the conversion issue in order to then take other actions. And if no other action is taken on cases with either of these two issues we just talked about, then this will be resolved at some point before the next renewal date, but the renewal might be the first touch of that case if everything else is going smoothly, where that may need to happen. And so the other term we want to go over today is benefit mismatch. And benefit mismatch means when those discrepancies are persisting and may or may not lead to a different eligibility result than what was in the legacy system when we go into the new system. So when this happens, anytime there would be that benefit mismatch and the level of benefit is in question, we are keeping folks on their legacy benefit until a worker is able to review and resolve. And so that will usually be something other than Magi Medical, because Magi has lived in the one system, and it's those other pieces that might have legacy information persisting. So benefit mismatch keeps a case that from fully converting, it'll be stuck in that conversion mode until other action is needed on the case. And actions taken in applicant portal on a case that is stuck in that conversion mode, they will result in worker review instead of giving a real-time determination. So for community partners, what that means is everything may look normal going through a case, but when you click to submit, instead of getting that determination, that approval, denial, things like that, you will get that a worker review is needed, no further action is needed on your side. Which is a message that many of you are probably familiar with, because another situation where that happens is when there is an incomplete or partial member match situation. Conversion mode and benefit mismatch, as I said before, they're not visible in applicant portal. So whether it has gone through smoothly or is stuck in conversion mode, you won't see anything that says that in the applicant portal, and Oregonians won't see that. But if you're seeing that worker review screen, in a situation where you in the past maybe would not have expected it, that is one clue that this might be what's happening to a case. And how does conversion impact renewals? The first thing I want to say is that conversion is not changing renewal timelines in any way, but during this transition period, we will see, and we have seen in the other parts of the state, more cases that require an active renewal instead of going through the auto renewal pathway. There are a lot of different reasons why someone might end up in the active renewal pathway, but this new one that we're seeing is cases that are in conversion mode or experiencing what we just called the benefit mismatch. So if someone is still in conversion mode, their case is persisting in that mode, they will not be able to auto renew. They will go through an active renewal process. So now that we've explained our terms and talked a little bit about what is going on with conversion and things you might see that might be a little outside of what you're used to seeing, what do you need to know? I'm going to reiterate that eligibility workers cannot make changes or update a case. They can't touch the case in any other way until that benefit mismatch or conversion issue has been resolved. Sometimes additional information will be needed to resolve the case that is not part of a medical application. We do want to make it clear that if there is some piece of information that would not be collected in the medical application, we do not expect community partners to know or chase that information. An Oregonian might be needed to provide additional information for their own case to clear it out of conversion mode.
I'd like to interject here, Jessica, and just say that I think a lot of people are experiencing this. There are questions in the questions box about it. Is this why I'm getting additional questions? And the answer is yes. Those additional questions, like Jessica said, are to unstick the case out of conversion mode in order to move forward to take any other actions. And it does present a challenge. And many of you are probably thinking, well, I don't have answers to those questions. And that's, we're aware of that. It's a sticky situation that's happening right now, and it's going to happen with Wave 2 counties also. And that Oregonian, the applicant, the client may be needed to provide additional information. So that is something that we do want to forewarn you about. And I know Jessica said it, but I'm just saying it in a different voice to make sure everybody's hearing it. And Jessica's going to talk more about that right now.
Thanks, Deanna. Okay, so what can we do as community partners to help folks navigate this? Because clients may need to submit information that is not included on the medical application, community partners can sort of help be that warm handoff and help the applicant or the member interact with our One Customer Service Center or local office, and help to make sure that that goes as smoothly and you can provide advocacy as you're able to within your organization. So step one is to explain that there may be additional information that is needed. Help to connect folks to either the customer service center or a local office, and know that at the end of the day, if there's information that the agency needs, the agency is going to do what it can to connect to that Oregonian, to send out notices or attempt communication, and to resolve these missing pieces of information or the discrepancies that may be showing up. There are a lot of tools that our eligibility workers have that do not involve talking to the client, so they're going to try those other tools first. And then they're also going to try working with the Oregonian. But if you have folks for whom this is not going smoothly, helping them understand that there are these temporary conversion complications that are possible, and that there are things we can do to help the eligibility workers and the client connect the dots together. One example that we sort of teased earlier but haven't really talked in depth about that we've been seeing is what we're calling conversion income, because that is what it looks like in the applicant portal. And what you would see is a word that you would expect to be, say, an income source or an employer name, instead says the word conversion. So you would see it potentially, for instance, on the earned income screen. There will be some sort of income, and instead of saying I work for coffee shop ABC, it says conversion and then an income frequency and amount. This happens because some of the legacy systems do not collect the exact same fields, the same information that the one requires. So if the legacy system did not require an employer or income source when income was collected, then there's nothing there, but we need to fill that field with something in order for the one system to process it and to be able to see it correctly. And so sort of the filler word conversion has been put in to fill in that missing information. Now, if you see that in applicant portal, you cannot edit this field. That has been locked down. And so you must work with an eligibility worker in order to resolve. We're asking that you do not try to get fancy or attempt a workaround in applicant portal. The best way to resolve this is to call the community partner line and to connect with the eligibility team and to update that income so that it has accurate information instead of the word conversion. And that conversion as a placeholder should not cause any trouble on the case in the meantime, but if you are updating income, for example, that is a time you would want to definitely make sure that you resolve that word conversion, so that the conversion income doesn't persist on into the future. We want to help everyone connect those dots as well. All right, I know that was a lot, and I know that we are at the questions section now. So I'm going to take a moment and we're going to comb through. I've seen a lot of great questions come up. So give us 1 second and we will start. We'll start asking and answering those questions.
Yep.